Hello guys, so now we shall be mainly discussing regarding the Thalamencephalon. Okay, so what is Thalamencephalon? We shall discuss right now. But before that, we have to write down what are the different parts of the brain. For example, forebrain you also call it as prosencephalon, right? So forebrain you also call it as prosencephalon. So this prosencephalon is divided into three different parts. Okay, so what are these three different parts? One part you have got is the telencephalon. One is called as your telencephalon. Another one is called as your rhinencephalon. Telencephalon, rhinencephalon, and the last part is called as your diencephalon. Okay, so these are the three important parts. What are the three important parts? One is called as the telencephalon, rhinencephalon, and the next one is called as your diencephalon. So we have in our previous lectures we have already discussed regarding the telencephalon, we have discussed regarding the rhinencephalon. Now regarding the diencephalon we have to discuss. Now how many parts is diencephalon divided into? Diencephalon is divided into two parts. Okay, so let me write it down. Diencephalon is in turn divided into two different parts. So what are these two different parts of diencephalon? The first part which we have got is our topic today, that is Thalamencephalon. Thalamencephalon. So one is Thalamencephalon and the other one is called as your hypothalamus. Thalamencephalon and hypothalamus. Okay. Now within this Thalamencephalon, there are in turn again three parts. So what are the three important parts within this Thalamencephalon? So within this Thalamencephalon, we have got three more important parts. So what are these three more important parts within this Thalamencephalon? One is thalamus. One is called as thalamus, right? Anything above should be called as epi, anything below should be called as hypo. So above is called as epithalamus. Epithalamus. So if it is below the thalamus, you have to call it as hypothalamus. Okay, below it is called as hypothalamus. So there are three different types. What are these three different types? One is called as epithalamus, another one is called as thalamus, and the third important one is called as hypothalamus. So all these three where are they present? They are present within the Thalamencephalon. Okay, so what did we discuss just now? We discussed prosencephalon is of three different types. One is called as telencephalon, rhinencephalon, and diencephalon. Diencephalon is again two different types. One is called as Thalamencephalon, another one is called as hypothalamus. Within this Thalamencephalon, there are three important parts. What are those three important parts? One is called as epithalamus, another one is called as thalamus, and the last one is called as hypothalamus. These are the three important parts. Now coming to this epithalamus, within this epithalamus there are three important structures which you have to know. So what are these three important structures within this epithalamus? So what are these three important structures? The first important structure which you would come across is called as habenular commissure and habenular nuclei. Okay, so what is this? This is called as habenular nuclei and commissure. What do you mean by habenular nuclei and commissure? I'll show you in the form of a picture. Okay, next important thing is you have got something called as epithalamus has got epiphysis. Epithalamus has got nothing but called as epiphysis. And finally the third important thing is posterior commissure. We have got something called as posterior commissure. So now let us see what are all these structures. We shall today discuss about what is this Thalamencephalon, and hypothalamus will discuss later on. Complete Thalamencephalon will discuss. We'll discuss about epithalamus, we will discuss about thalamus, hypothalamus. We shall look at those pictures. We shall discuss about the borders also, right? Borders and surfaces also. So first of all, what I will do is that let me draw one picture. So if you have watched my previous lectures, there this picture already I have drawn it, right? So if you have watched them already and if you are coming to this lecture, then you can just fast forward it. But if there is anyone who is watching this for the first time or this is their first video, then I'm telling you to watch the complete video right now. Okay, so I'm going with the complete basics. So now let us discuss. I'll draw the medial surface, right? The medial surface of your cerebral hemispheres. where the corpus callosum and all is present, and then we shall discuss. So what is the medial surface? For example, if these are your cerebral hemispheres, so this is called as the right cerebral and the left cerebral hemisphere. Now both the cerebral hemispheres are joining together with the help of corpus callosum, right? So this one which you can see here is called as a superolateral surface, and this is also called as a superolateral surface. Now what I am doing is that when I divide the both cerebral hemispheres, when I show you this part to you like this part is called as the medial side of the cerebral hemisphere. So this is the picture which we shall be drawing right now. Okay. So let us discuss about the medial surface of the cerebral hemisphere. Right. So in this medial structure which you can see over here, in the center you have to draw one very important structure like this. This important structure which I am drawing right now is nothing but called as your corpus callosum. So this structure over here is called as your corpus callosum. Now this corpus callosum has got some very important parts. For example, this red color thing which I am drawing right now is called as the genu of corpus callosum. Okay, and after that these structures which I am transversing right now here, right, these structures are called as the body of the corpus callosum. And after that, the last important part is this green color part. This is called as what? This is called as the splenium of the corpus callosum. So what are the structures we have got here? We have got one is called as a genu, we have got the body, and we have got the splenium of the corpus callosum. Now second important structure which you can see over here is that here there is one very important structure which is present in this way. Now what is this important structure, guys? This structure which I am drawing right now, this is called as your fornix. Okay. Now after this discussion of fornix is done, the second important structure which I am drawing right now over here, as you can see these lines, right? So what is this structure over here called as? This structure over here which I am drawing right now is called as your septum pellucidum. Okay. So this shading which I am giving right now is here, these boxes are nothing but called as your septum pellucidum. So let us name all these things right now. So one by one let us name these things. So this part over here which I told you, what is this? This is called as a genu, G-E-N-U. Okay. Next you have got this part, you call this as a body. This is called as a body. Next, this part over here, whatever you can see, this is called as what? Fornix or septum pellucidum. This is called as septum pellucidum. This is called as septum pellucidum. And this part over here which you can see here, this is called as your fornix. One is septum pellucidum and the other one is called as a fornix. And this green color part which you can see, right? So this green color part over here is called as your splenium. This is called as your splenium. So what are the structures we have discussed? We have discussed body, genu, septum pellucidum, and we have discussed fornix, as we have discussed splenium. Now you might think this corpus callosum, beneath this corpus callosum you have got septum pellucidum. You might think the entire length of the corpus callosum septum pellucidum is attached. No, actually septum pellucidum is attached exactly in the center. For example, let me draw this picture over here and explain you this thing. Yeah, let me draw it here. So if you carefully look at this, see, this is your corpus callosum like this. Okay, this is your corpus callosum, for example. This is your corpus callosum. Where is your septum pellucidum located? Septum pellucidum is exactly located in the center over here. You see, this is your septum pellucidum like this. Yeah. So this particular part, whatever I have drawn over here, this part over here is called as your septum pellucidum. Okay. You see, this part over here is called as your septum pellucidum. You see, where is septum pellucidum located now? Septum pellucidum is located exactly in the center. Now beneath this septum pellucidum, you have got some structure called as fornix. So this is the same picture. Septum pellucidum, beneath the septum pellucidum, you have got a structure called as fornix. Right? Next important thing. Next important thing is that let me now itself draw the midbrain over here. Now where is exactly the midbrain present? See, this is the location of your midbrain. So this part is your midbrain. This is your midbrain. Okay. We will complete the picture of the midbrain later on, but for now what we shall do is that we shall discuss some more important structures. For example, there is just beneath the genu, there is a small structure that is hanging down like this. Actually, it is not hanging down. So this structure which I have drawn over here is called as a rostrum. Okay. So what is this structure called as? This structure is called as your rostrum. Okay. Next, just beneath your rostrum, you have got another important structure like this. This structure over here is called as your anterior commissure. Okay, this structure over here is called as your anterior commissure. Anterior commissure, right? This is called as your anterior commissure. Now, just beneath your anterior commissure, you have got another structure which is elongated like this. You see, there is another structure which is elongated down all the way like this. So what is this elongated structure which I am drawing right now? This is called as your linea terminalis. Okay, so this elongated structure which I am drawing right now is called as your linea terminalis. So this particular one over here is called as your linea terminalis. Linea terminalis. Now, beneath your linea terminalis, here you have got another important structure like this. See, beneath your linea terminalis, here you have got another important structure over here, right? So, this structure which I am drawing right now, which is located beneath your linea terminalis, this is called as your optic chiasma. Okay, so this particular structure over here is called as your optic chiasma. Optic chiasma. Okay, so one is your linea terminalis. Beneath your linea terminalis, you have got optic chiasma. Now, beneath your optic chiasma, let me move this picture up down. Right, beneath your optic chiasma, just side to the optic chiasma, you have got an other important structure like this. This structure over here is called as tuber cinereum. You see, this structure over here is called tuber cinereum. And what is happening? The tuber cinereum is forming a cone-shaped projection. Right, so this conical projection of tuber cinereum is nothing but called as medial eminence. Okay, so let me name this part. See, this part over here is called as your tuber cinereum. Tuber cinereum, and tuber cinereum is forming this conical projection, and this conical projection over here is called as your medial eminence. This is called as your medial eminence. Now, just beneath this tuber cinereum, you have got another structure that is coming down all the way, or it is hanging down all the way down like this. So, this structure is called as your infundibulum. Okay, this structure over here is called as your infundibulum. I hope you heard of this infundibulum somewhere, right? So, infundibulum is also called as pituitary stalk. Infundibulum. Infundibulum, or you can also call it as pituitary stalk. Pituitary stalk. Okay, so one is called as your tuber cinereum. Tuber cinereum formed a conical shaped projection that is called as medial eminence, and from the medial eminence you see a structure that is hanging down, and this structure is called as pituitary stalk. And obviously here you have got your pituitary gland. So obviously all of you know that we have got two parts within the pituitary gland. One is called as the anterior pituitary, another one is called as a posterior pituitary. And where is this pituitary gland located? Pituitary gland is enclosed within the sella turcica of your sphenoid bone. So I hope till here you are clear, right? The second important thing, what is the next important thing is that just behind this tuber cinereum, you see a small pink color body over here. This small pink color body which I have drawn over here is called as your mammillary bodies. Okay, so this particular structure over here is called as your mammillary body. This particular structure over here is called as your mammillary body. Next, just behind this mammillary body, if you very closely look to another important structure, look here now. let us say this is the structure over here, and just behind this mammillary body I am drawing another important structure, but this structure, you see what it is doing, it is making holes within the substance. Now this perforated substance whatever is there is called as posterior perforated substance. Where is this posterior perforated substance present? This posterior perforated substance is present behind your mammillary bodies. So just remember this. What is the first important thing we have discussed? The first important thing over here we discussed is optic chiasma, right? Behind the optic chiasma, what is the thing? Tuber cinereum is present. Behind the optic chiasma, we have got tuber cinereum, and behind the tuber cinereum, we have got something called as medial eminence. After medial eminence, okay, leave the medial eminence part. The optic chiasma, tuber cinereum, and after that we have got mammillary body over here, right? Now let us look at these parts over here. So in this picture, which I have already drawn it and kept, okay, not for this lecture, this was a previous lecture which I have recorded. So in this previous lecture which I have told you, what did I tell you? The first important thing is optic chiasma, right? See, this center point which you can see, the dot, right? This dot is nothing but called as your optic chiasma, okay? Now after this optic chiasma, the next important thing in the row is this one. What is this called as? This is called as your tuber cinereum. You see, this is called as your tuber cinereum. So what did we discuss there? Behind the tuber cinereum, what do we have? We have got mammillary bodies. See, behind the tuber cinereum, we have got two mammillary bodies. Behind the two mammillary bodies, what do we have? We have got a substance which is perforated, and that is called as posterior perforated substance. You see, this is a posterior perforated substance. Okay. So now let us look at the same picture over here. So this is your optic chiasma. Behind that you have got your tuber cinereum. Then you have got your mammillary body, and after that this particular structure over here, is called as your posterior perforated substance. Posterior perforated substance. So this is your posterior perforated substance. Now behind your posterior perforated substance is what you have your midbrain like this, right? This is your midbrain. Now within this midbrain also, for example, if I make some lines over here guys, okay, let us say, let me make some lines over here, because I just wanted to show you one very important differentiation over here. So let us say I'm making some lines, some random lines over here, okay. Now we can, behind this midbrain also you have got, let me put some gap over here. You see, behind this midbrain you see a small gap that is coming all the way down, right? You know what is this gap which is present behind this midbrain? This, within the midbrain, this is what is called as your cerebral aqueduct. All of you know what is cerebral aqueduct, right? I have discussed it in the ventricles. So this is your cerebral aqueduct, okay. Now this is the cerebral aqueduct which is dividing this midbrain into two parts. This upper part whatever you can see, you see this upper part whatever you can see, right? Upper part in the sense this entire part, okay. So this upper part whatever you can see, this is called as tegmentum of the midbrain. Tegmentum of the midbrain. Tegmentum of the midbrain. And this part over here is called as your cerebral aqueduct. Cerebral aqueduct. So midbrain, with the help of the cerebral aqueduct, is divided into two parts. The upper part is called as tegmentum of the midbrain. The remaining part is simply called as the midbrain, part of the midbrain. So I hope you understood all these things. Now second important thing, now this is the most important part which you have to know. Here you have got a very important structure, okay. Let me draw it another color. There is a very important blue color dot like structure. This dot like structure is nothing but called as your pineal gland, okay. So what is the name of this gland over here? This is called as pineal gland. What is the other name for pineal gland? Pineal gland is also called as epiphysis. Pineal gland is also called as epiphysis. Now what I am telling to you is that from this pineal gland you see a stalk that is coming. This stalk is called as pineal stalk, right? The same way as this pituitary gland is having a stalk called as infundibulum, right, or pituitary stalk, in the same way pineal gland is also having a stalk called as pineal stalk. And this pineal stalk divides into two parts. See here, This pineal stalk is dividing, let us say this is your pineal stalk all the way here. This pineal stalk is dividing into two parts. What are these two parts? The upper one is called as superior lamina and the lower one is called as inferior lamina. Now what will happen with this superior lamina? This superior lamina will come anteriorly forward and again it is going backward and again it is coming anteriorly forward and it goes and attaches here. Okay, but whereas this inferior lamina is going all the way and attaching down like this. Now to the superior lamina, you have got a very important structure. A very important structure that is present near this superior lamina. You see this? This is called as habenular commissure. You heard of this habenular commissure over here, habenular nuclei and commissure. I'll come to that point in a minute now. So this part is called as habenular commissure. And the part that is present over here is called as a posterior commissure. Okay, so how many lamina do you have? This one is called as a superior lamina. This is called as your inferior lamina, right? Superior lamina went anteriorly forward, posteriorly backward and again anteriorly forward and attached there. So to the superior lamina, you have got a commissure and that commissure is called as habenular commissure. In the same way, to the inferior lamina also you have got a commissure and that commissure is called as a posterior commissure. Okay. Now, second important thing is that now overall if you look, do you find a cavity over here? Overall, if you see, can you figure out a cavity over here? Right? So what is this cavity? Can I call this cavity as the cavity of diencephalon, or can I also call it as this is a third ventricle over here? So this entire is called as third ventricle. So this third ventricle over here, or you can also call it as diencephalon. Cavity of the third ventricle is diencephalon. Okay, so cavity of the diencephalon is your third ventricle. Okay, so this third ventricle of the diencephalon is having how many walls? It is having a roof, it is having an anterior wall, it is having a floor, it is having a posterior wall. Now just by looking at these structures which I have drawn here, you can easily tell what is the roof of the third ventricle formed by. What is the floor formed by? What is the posterior wall formed by? What is the anterior wall formed by? Okay. Now what I am telling you is that this third, there is a very important structure again. See, this structure which I am drawing here, can you see? Right. So there is a very important structure like this. Right. So this structure, you can also call this thing as sulcus. You see, this is the sulcus which I am drawing right now. Exactly obliquely present from one end to another end in the center of the third ventricle. So this sulcus, whatever I am drawing right now, is called as a hypothalamic sulcus. Okay, so let us name this part. This sulcus over here is called as hypothalamic sulcus. So hypothalamic sulcus is dividing the ventricle, third ventricle, into two parts. The upper part above the sulcus, whatever you have got above the sulcus, this is called as thalamus. Okay, below the sulcus, whatever you have got is called as hypothalamus. So thalamus as well as hypothalamus. So there are two important structures. Above you call it as what? Above you call it as thalamus. Below the sulcus you have called it as below anteriorly, above posteriorly. Above backward, below forward. Above backward you call it as a thalamus, below forward you call it as a hypothalamus. Okay, right. So these are some of the structures which you can see, but now our discussion will be mainly on one part, that is your thalamus. Okay, that would be mainly on thalamus, right? So by the way, let us just label these parts and then go on to then another. So this part over here, which I already told you, this is called as your pineal stalk. Pineal stalk. And superior lamina, inferior lamina, and this over here is called as your habenular commissure. This is not nuclei. Habenular commissure. Okay, and what is this commissure? This is called as your posterior commissure. Posterior commissure, and one is called as habenular commissure. Next, if this is your pineal stalk is divided into how many laminae? 2. This is called superior laminae and this is called inferior laminae. Now between the superior and inferior laminae, can you see a triangular shaped portion? This triangular shaped portion is called as a recess. Okay, for example, you see this, you see a triangular shaped portion over here, right? So this triangular shaped portion which I am drawing right now is called as your recess. What is this recess called? This is called as pineal recess. Okay, in the same way, you have got another recess that is present above here in this gap. Okay, what is this recess called? This recess is present above the pineal region, so I have to call it as suprapineal recess. So there are two recesses over here. See, this recess over here is called as suprapineal recess, and this one over here is called as your pineal recess. So how many recesses you have got over here? One recess you call it as a suprapineal recess. This is called as your pineal recess. So one is called as a suprapineal, another one is called as a pineal recess. And next important thing is, here you have got habenular commissure. Okay, this commissure over here is called as your habenular commissure. Right. So these are the important things. Now in this important thing, first important thing I have to tell you here is that we have to discuss about this thing. What is this thing? Habenular nuclei and habenular commissure. All of you know where is this habenular nuclei. It is present back of the thalamus or in front of the thalamus. Obviously, if you see, this is your frontal pole. Okay, this is your temporal pole, and this is your occipital pole. Frontal pole, temporal pole, and occipital pole. So now tell me, is this habenular commissure located at the back or at the front? It is located at the back of what? Back of thalamus. Okay, posterior to the thalamus. Now, what is this habenular commissure and habenular nuclei? Actually, this is called as habenular nuclei. This is called as habenular nuclei. In between both of these nuclei, you have got fibers that are running in between. These fibers is called as habenular commissure. Okay, so this is called as habenular nuclei. Okay, so here also you have got habenular nuclei on the other side, and in between both of them you have got this part that is called as habenular commissure. Habenular commissure. Okay, next important thing is that we have completely discussed about what is habenular nuclei and habenular commissure. Now when anyone is asking you what is this habenular commissure, you have to tell that this is a part of epithalamus, which is internal part of Thalamencephalon, which is internal part of diencephalon. Why diencephalon? Because this entire cavity is called as a diencephalon, right? Now after this, let us see where is this epiphysis present. First is, you have seen where is habenular nuclei and commissure present. Now let us see where is this epiphysis. So to see this epiphysis, first of all, let me draw the thalamus. Okay, so let me draw one easy picture over here. You see, this is your thalamus, let us say. Okay, let us say for namesake that this is your thalamus. Okay, this is your thalamus, and behind the thalamus I have already told you that here you have got this particular body. What is this? This is called as pineal gland. Okay, this pineal gland is having a stalk, and this stalk is called as pineal stalk. This pineal stalk will divide into two parts. One is called as superior laminae, another one is called as inferior laminae. Now this superior laminae comes anteriorly forward, posteriorly backward, again anteriorly forward, and then goes and attaches like this. Now coming to the inferior laminae, the inferior laminae comes like this all the way and goes and attaches. Next, there are two commissures I told you. See, here you have got one commissure. Okay, let me use another color. Yeah, see, you see here you have got one commissure. This commissure I have just now told you that this is called as habenular commissure. Next, you have got another commissure over here. This commissure is called as what? Posterior commissure. So what is this commissure over here? This is called as habenular commissure, and this commissure over here is called as your posterior commissure. One is called habenular commissure, another one is called as posterior commissure. Now, you tell me here, what are the structures that are located back? If this is an anterior, this is a posterior. What are the structures that are forming the posterior wall of thalamus? Tell me, what are the structures that are forming the posterior wall of the thalamus? The first important structure which I would like to mention over here is habenular commissure. Okay. Next important structure I would like to mention here is, this is your pineal gland or pineal body, pineal gland or pineal body, right? The third important structure over here is posterior commissure. So there are three important structures: habenular commissure, pineal body and posterior commissure. So all these are the structures that together they form the posterior wall of the third ventricle. Posterior wall of your third ventricle. Okay, so all these three structures together you call them as epithalamus. Epithalamus. Okay, so we were discussing about epithalamus, right? So what is epithalamus? Habenular nuclei and commissure, epiphysis and posterior commissure. Three of them together you call it as epithalamus. Okay, so this is all you need to know regarding the epithalamus. So after this epithalamus, the next important structure we have to discuss is about the thalamus, right? So what is the important thing about thalamus over here? If you look at the structure of a thalamus, right? So this is how the structure of the thalamus looks. So it is almost in the form of an egg, right? Now this thalamus has got three parts. What are these three parts? See, this is called as the anterior end of the thalamus. This is called as a posterior end of the thalamus, or the posterior surface of the thalamus. This is called as the superior surface of the thalamus. This is called as the inferior surface of the thalamus, and this surface is called as a lateral. And on the other side you have got the medial surface, right? For example, if I draw a dotted line all the way like this. Now this dotted line is dividing the thalamus into the large anterior part, right? Now tell me, is the anterior part sharp or blunt? Obviously the anterior part is blunt, right? Now coming to the posterior part, how is the posterior part? Blunt or broad? The posterior part is broad. The posterior part is broad. You know what is the other name for this posterior part? It is also called as pulvinar part. Posterior part is also called as your pulvinar part. Okay. Now to this pulvinar part or to this posterior part, you have got two important structures. Let us say these two important structures over here. This is one important structure and this is another important structure over here. One is this one like this, and this is another important thing like this. Now this important structure over here which you can see here, right, and there is a blue color structure also which you can see over here. So this structure which you can see over here, this is called as a lateral geniculate body. This is called as a lateral geniculate body. So if that is called as a lateral geniculate body, and this one over here is called as your medial geniculate body. Medial geniculate body. So there are two important bodies over here. What are these two important bodies? One is called as a medial geniculate body and the other one is called as your lateral geniculate body. Okay, where are they present? They are present to the pulvinar part. And you know one very important thing, this medial geniculate body and lateral geniculate body together you call them as metathalamus. Together you call them as metathalamus. What are you discussing right now? We are discussing about the thalamus. Now in the thalamus we found out two structures over here, and by the way just let me rub this out. This is not hypothalamus over here. Hypothalamus is already written over here. This is your metathalamus. Metathalamus. Okay. So what are the things we were discussing? About epithalamus we are done. Now coming to the thalamus, I have discussed that thalamus is having an anterior part, posterior part, and posterior part is also called as a pulvinar part. Posterior part is having two bodies. What are those two bodies? Geniculate body, one is called as a lateral geniculate and medial geniculate body. So together both of them you call it as your metathalamus. Now what we shall do is that within this thalamus only we shall discuss some more important structures whatever are present within this thalamus. Okay, so let us discuss about the thalamus now. Right. So if I have to discuss about the thalamus, first of all, let me draw this picture over here. Right. Now in this particular picture which you can see, here, let us say that this part which I am drawing right now, what is this? Anyone, any guess? This part over here is called as your corpus callosum. Okay. Now just beneath the corpus callosum, there are two structures. For example, see this structure over here on both the sides is called as your thalamus. One is called as the right thalamus, another one is called as the left thalamus. Now beneath the thalamus you have got hypothalamus. Beneath the thalamus, how do you got hypothalamus? Look at this picture over here. You see, there is thalamus here. Beneath the thalamus, what is there? Hypothalamus. What is it dividing thalamus from hypothalamus? You see, what is the sulcus here? Hypothalamic sulcus. Okay. So, thalamus as well as hypothalamus. Next, down over here, we have got your midbrain. So, let us say this structure over here is midbrain. Okay. So, this is your midbrain. Now, in the center of the midbrain, you see a duct over here. What is this duct called as? Midbrain duct. What is this duct over here called as? Cerebral aqueduct. Okay. So, in the center, you can see this particular thing over here. This is called as your cerebral aqueduct. This is called as your cerebral aqueduct. Now, here, what did I tell you? In this particular picture over here, if this is your corpus callosum, in the center of corpus callosum, you see something that is hanging down. What is that? Septum pellucidum. So, if this is corpus callosum, exactly in the center, there is a structure that is hanging down like this. What is this structure? This structure over here is called as your, yes, what is this? Septum pellucidum. And beneath the septum pellucidum, these two ball-like structures, what you can see over here, this is called as your fornix. Okay, so the same things which we have discussed, now we have just changed the position, that's all. So this one over here is called as your corpus callosum, and this one over here is called as your septum pellucidum, and obviously this part over here is called as your fornix. Now if you see over here, right, now where is the third ventricle? Where is actually the third ventricle? You see, this particular part which I will be highlighting right now, you see this particular part is your third ventricle. Okay, so this particular part over here is your third ventricle. And then what about these two? What about this particular part over here? You see, this particular part, right? You know what is this called as? This is called as the lateral ventricles. How many lateral ventricles we have got? We have got right lateral ventricle, left lateral ventricle. You see, this is right, and now whatever I am drawing is your left lateral ventricle. So you have got two lateral ventricles, right and left. And by the way, not to forget that this is your thalamus, this is your hypothalamus. Here also thalamus and hypothalamus. Now, if this is third ventricle, if these two are 1 and 2 ventricles, now ventricles inside, they have to be lined by some epithelium. The epithelium which is lining the ventricles is called as ependyma. Okay, see now, you see this epithelium which I am drawing right now. This is the epithelium that is lining what? This is the epithelium that is lining your ventricles. So the epithelium that is lining the ventricles is called as your ependyma. You see the epithelium, how it is lining your ventricles, right? So this epithelium which is lining the ventricles completely, this particular one is called as ependyma. And these cells are called as ependymal epithelial cells, which are ciliated cells. They have got cilia. Why do you need cilia? Because within the ventricles, what do you have? You have got CSF. So to move the CSF up and down, you need ciliary movement, right? So this cilia promote the movement of the CSF. Right. So till here, I hope all of you are clear. Now what we shall do? What we shall do is that, first of all, let us write down what is the epithelium that is present within the ependyma. That is simple cuboidal epithelium. So this epithelium is simple cuboidal epithelium. So this epithelium over here is your simple cuboidal epithelium, right? Right. What we shall do here is that we shall right now discuss what are the surfaces over here. I have already discussed about these surfaces, right? So here we have got surfaces. For example, this is called as a superior surface, this is called as the inferior surface, posterior surface, as well as anterior surface. Now let us see what are the structures that are forming the superior surface of your thalamus. Okay, so let me draw one picture over here. So let us say this is your thalamus, this is your thalamus, and remember that this entirely is your superior surface of your thalamus, right? So to the superior surface of the thalamus, what are the structures we have got? See, first important is, you see what is this? This structure which I am drawing right now is your caudate nucleus. And by the way, to the tip of the caudate nucleus or to the tail of the caudate nucleus, in the previous lectures I have discussed what is caudate nucleus, right? So if this is your thalamus, above the thalamus, this particular structure which you can see is nothing but called as your caudate nucleus. Caudate nucleus. Caudate nucleus has got few parts. For example, this is called as a body of the caudate nucleus. This is called as a trunk of the caudate nucleus, and this is called as a tail of the caudate nucleus. Now to the tip of the tail of the caudate nucleus, we have got a rounded body here. This rounded body is nothing but called as amygdaloid body. What is this? This is called as amygdaloid body. This particular body is called as amygdaloid body. Now listen carefully now, from this amygdaloid body, okay, from this amygdaloid body, you see some nerve fibers that are coming. You see these nerve fibers are entering into the tail like this, and they are exiting out of the tail, right? You see some more nerve fibers that are coming into the tail and exiting out like this, right? Now these nerve fibers, whatever are starting from the amygdaloid body, they are passing within the tail, and at the center near the trunk region, they are coming out of the tail. And where are they ending up? They are ending up into another structure called as a hypothalamus. Hypothalamus. You know what are these group of nerve fibers called as? These group of nerve fibers, whatever you can see, these are called as stria terminalis. What are these called as? These are called as stria terminalis. Now don't confuse with the linea terminalis, that is a different thing. This is stria terminalis. Okay. Now let us write down what are the structures that form the superior surface of your thalamus. Superior surface of your thalamus. Let us write one by one now. So let us look at the first important structure. The first important structure is, can I tell that the caudate nucleus is forming the roof, the superior surface of the thalamus, right? So the first important structure would be your caudate nucleus. Caudate nucleus. Okay. Now after this caudate nucleus, the second important thing is this stria terminalis. Okay. The second important thing is stria terminalis. So by looking at this like this, you might feel stria terminalis might not form the roof, right? In this picture they are present side to side, but in the actual picture you would see that stria terminalis is crossing over the roof of the thalamus. Okay. Next, after that, the third important thing. What is the third important thing? Third important thing is that just focus on this part over here. Now what I'll do is that I'll rub this part a little bit, right? I'll rub this part a little bit, and let me draw this ependyma in this way. On the other side also, let me rub this part a little bit, and let me draw the ependyma in this way. Right. Now in this, if you see this part which I am drawing right now, all of you just focus. See this part, whatever is there, which I am highlighting right now, right, with the green, this part is called as the superior surface of the thalamus. Yes or no? This part is called as the inferior surface of the thalamus. Next, this part is called as the medial surface of the thalamus, and this part which is projected outside is called as the lateral surface of the thalamus, right? So what are the surfaces? We have got superior surface, we have got inferior surface, we have got medial surface, we have got the lateral surface. Now if you look at the superior surface here, exactly here, you have got a small blue color dot which I am drawing here, right? You know what is this blue color dot? This blue color dot is nothing but called as thalamostriate vein. What is the name of this vein over here? What is the name of this small vein? This small vein is called as thalamostriate vein. Where is this present? Is it present above the thalamus or below the thalamus? It is present above the thalamus. So this particular small vein which you can see over here is called as your thalamostriate vein. Thalamostriate vein. Fourth important thing is that if you look at this picture over here, right? If you look at this picture over here, right? Now what I will do is that let me put that same picture here down. You see, this is your thalamus, right? Okay, let me draw this thing. See, this is your corpus callosum like this. This particular part is your corpus callosum. Next, down here you have got what? This is called as your septum pellucidum. And down here you have got these two parts. What are these two parts over here? These two parts over here are called as your fornix. And here, and exactly here you have got this particular part. What is this? This is called as thalamus. And beneath the thalamus another structure. What is this? This is called as hypothalamus. Clear? Now, what is this part, guys? What is this part which I am drawing right now? This is your lateral ventricle. Specifically speaking, this is your right lateral ventricle. On the other side, you have got the left lateral ventricle, right? Next important thing, what is this part? Tell me, what is this part? Is this the roof or the floor? This is the roof of the, or this is the superior wall of the thalamus. So superior wall of the thalamus, one thing I have already told you, that this small blue color dot, whatever I have drawn here, is a thalamostrial vein, right? Thalamostriate vein. Now apart from thalamostriate vein, if you concentrate on the ventricle here, right lateral ventricle is also having three parts. See, this part whatever I am drawing with the black is looking laterally, so this is called as a lateral wall. This part which I am drawing with the dotted lines is looking medially, this is called as a medial wall. And in the same way, you see this part which I am highlighting right now, right, this is called as the floor of the lateral ventricle. So can I tell that the floor of the lateral ventricle forms the roof or the top surface of the thalamus, right? So I have to write here the fourth important thing, that the floor of lateral ventricle. Floor of the lateral ventricle. So what are the structures that form the superior surface? One is your caudate nucleus, stria terminalis, thalamostriate vein, floor of the lateral ventricle. These are the structures that form the superior surface, right? Now once the superior surface is done, let us now see what are the structures that form the lateral surface, okay? So after the superior surface is done, let us see what are the structures that form the lateral surface. So what are the structures that form the lateral surface, guys? Just let us go back over here, right? In the lateral region, in the lateral surface, what are the structures do we have? See here exactly, if you look here, there is one structure which is in the form of an reverse L shape, right? So can anyone name what is this reverse L shaped structure? This reverse L shaped structure is nothing but called as your internal capsule, okay? Just in front of the internal capsule, you have got a biconvex shaped or a lens shaped structure like this. This lens shaped structure is called as lentiform nucleus, okay? So what is this structure over here? This is called as your internal capsule. Now if I draw the internal capsule over here, this is your internal capsule like this. This is your internal capsule. Now in this internal capsule, here you have got a lens shaped nucleus. This is called as lentiform nucleus, right? Now all of you look here, this internal capsule is having two limbs. This is called as the anterior limb of the internal capsule. This limb over here is called as a posterior limb of the internal capsule. Now between the anterior and posterior limb, this one over here is called as the lentiform nucleus. Lentiform nucleus. So what are the things you have got? Anterior limb of internal capsule, and this is what? Internal capsule. Internal capsule. So we have got anterior limb of internal capsule, posterior limb of internal capsule, we even have got lentiform nucleus. Now you tell me, by looking at this picture, which is the lateral surface? See, this one over here is the lateral surface of the thalamus. Now in this lateral surface of the thalamus, this lateral surface of the thalamus is facing anterior limb of internal capsule or posterior limb of internal capsule? Obviously, by this picture, it is very clear that this is facing only the posterior limb of internal capsule, right? So, only one structure we have got over here on the lateral surface. What is that? That is your posterior limb of internal capsule. Posterior limb of your internal capsule. Okay, right. Next important thing, let us see what are the structures that are present to the medial surface. Now, by this picture itself, it will be very clear for you which is the medial surface. See, this particular structure is a medial surface. Now, if this particular structure is a medial surface is facing what? It is facing your third ventricle. Yes or no? For example, if I divide the third ventricle like this, if I divide the third ventricle into two halves. So, in these two halves, the upper one is called as the superior and the lower one is called as the inferior, right? So, exactly this part, guys, see, exactly this part of the third ventricle is called as the postero-superior part of the third ventricle, right? It is posteriorly present. In this picture, you cannot see posteriorly, but it is superiorly present, right? So, postero-superior part of the third ventricle. Now, within the third ventricle also, you have got lateral walls, medial walls, right? So, if you see in this picture, this is called as a lateral wall. You see this entire border is called as a lateral wall. You see this entire border is called as a lateral wall. So, which is the medial surface here? The medial surface is nothing but the posterior superior part of lateral wall of third ventricle. Posterior superior part of the lateral wall of third ventricle. Right. And final surface which we are left over is with the inferior surface. If you look at the inferior surface, what are the structures that are located to the inferior surface? Now, inferior surface of the thalamus. Inferior surface of the thalamus in the sense this one, right? So, if this is the thalamus, you see this is the inferior surface. Inferiorly, what do we have? Hypothalamus. So, first let me write it down. Inferiorly, I have got hypothalamus. Inferiorly, I have got hypothalamus. Second important, after this hypothalamus, the second important thing inferiorly, what do you have? So, if you look this as a thalamus, the inferior wall of the thalamus, inferior in the sense, you see, if I am putting a line all the way down here, what do you have? You have got your hypothalamus, right? Second important thing, if I am putting a line all the way down here, this part, you know, this part, it is projecting towards this part of the midbrain. And by the way, this entire part on the back, you call it as the tegment of the midbrain. Now, exactly this small pink color part which I mentioned over here is the subthalamic tegmentum of the midbrain. Why subthalamic? Because it is right behind, right beneath the thalamus. So, this part is called as the subthalamic part of the tegmentum of the midbrain. So, two important structures you have got over here. One is called as a hypothalamus and the other one is your subthalamic tegmental region of the midbrain, right? Subthalamic tegmental region of the midbrain. So, let us see what are the structures overall which we have discussed, guys. So, today we have completely discussed regarding the Thalamencephalon. In the Thalamencephalon, three important parts. Epithalamus we have discussed, thalamus we have discussed and metathalamus we have discussed. Now, coming to this epithalamus, we have got habenular nuclei as well as commissure. I have told you, if you remember, there are two nuclei called as habenular nuclei. Attached to these two nuclei, we have got a commissure. This commissure is called as habenular commissure. Next, we have got epiphysis and after that we have got posterior commissure. So, I have shown you here where are the habenular nuclei, where is the habenular commissure, where we have got the epiphysis which is also called as a pineal gland, and finally the posterior commissure down here we have got. Okay. After that we discussed about the thalamus. I told you the posterior part of the pulvinar part is having two bodies there. Those two bodies are called as, one is called medial geniculate, another one is called as lateral geniculate. So, these medial and lateral geniculate together you call them as metathalamus. Now, regarding the thalamus also we have discussed all the important surfaces over here, right? So this is all you need to know regarding the topic of diencephalon, guys. In the diencephalon, we mainly focused on Thalamencephalon. So this is all you need to know regarding the Thalamencephalon. Thank you so much for watching my video. Goodbye.